Hello, my name is Gary Delgado and I will be teaching your class today. Today we're going to talk about care of the pediatric patient and some of the illnesses that we take care of in pediatrics for patients when they're in the hospital and when they come to our clinics. Learning knows no bounds, and we are talking about this subject because you guys are in the LVN to RN class and you're about to graduate and you'll be taking your NCLEX. So we will be reviewing things that you guys wanted to talk about. This is your graduating course, and again, when we first met, we talked about it, and this was a subject that you guys felt you needed the most review of. And since I am a certified pediatric nurse as well as an educator, we're going to go ahead and do our presentation about pediatric care today. Now you guys have your handouts and you can review as we go through our slideshow, okay? Okay, well, here we go. Outcomes. One of the first things we're going to talk about are our outcomes. And the first outcome that we have is for you guys to recognize pediatric vital signs. And we're going to go over the ages of our patients as well. We also want you to be able to identify common pediatric illnesses and the nursing interventions that we typically perform when we're taking care of these patients. Also, we want you to be able to relate to nursing theory. We want you to be able to relate nursing theory to pediatric nursing care. And here we go. And something came up here. Sorry about that. Okay, back to our slides. So we're going to talk about pediatric patients, the age range, and vital signs. These are the first things that you do when you are taking care of a pediatric patient. When they come through the door, the first thing you're going to do is get some intake information. You're going to be talking to parents. Usually parents are upset, but you still need to take care of the vital signs. So you find out the patient's age, and then you're going to be looking for their heart rate and their respiratory rate. Just remember, when you have infants that you're taking care of, some of the most important things are checking their respiratory rates. And for infants, you're going to notice that they breathe much faster than the rest of us. So it's not uncommon for you to see a child, a 9-month-old or 3 to 9 months, so we'll say neonate to 1 month, let's go by our rate. Their heart rate is anywhere from 85 to 175 beats per minute, and the respiratory rate is anywhere from 30 to 60. Now, as you can see, if you go all the way down to 12 years of age, their heart rate is normal, and their heart rate is 60 to 100, and their respiratory rate is 12 to 20, which is our normal rate. But when they're newborns, when they're neonates, when they're young children, their respiratory rates are much higher than ours. And then they start to slow down as they get older. They go from 30 to 60, 30 to 50, 17 to 40, 16 to 42, all the way until it gets to the normalized adult age from 12 on, all the way to 12 to 20 respiratory. Okay. So now, providing pediatric care. So first we're going to talk about some of the common pediatric illnesses in nursing care. So most of the time when your kids come into your clinics, a lot of you guys are LVNs that are graduating as RNs, and so you probably already see this. You see children coming in with that cough and runny nose, asthma, so when you hear that dry cough, ear infections. We're going to talk about emergencies. You're going to see burns as well, patients coming in, pediatric patients. And then you're going to see nausea, vomiting, especially during this type of season. When we're in the middle of the flu season, you're going to see these types of patients coming in. So cold and cough, the notorious rhinovirus. So when pediatric patients come in, some of the common things they have are the common cold. And with that, you're going to see that they have coughs, and common symptoms of the cold are the coughing, the sneezing, the little runny nose. A lot of times if these patients get swabbed, they'll end up coming positive for rhinovirus. The more severe illness would be the flus and those types of things. The things you want to be careful with when we're talking about children, when they're coming in with what we think are common cold symptoms, is looking out for something else, ear infections. And with ear infections, you're looking for with ear infections, you're looking for that fever. You're looking for that fever, you're looking for the children to be pulling their ear. A lot of times they'll be crying, they'll pull their ear. They will have some of those common cold symptoms, coughing, runny nose, but fever and typically pulling of the ear, those are some of your dead giveaways for a potential ear infection. So often following a little cold, they can develop a fever and pain, and these are some of the signs of an ear infection. Irritability again, pulling at the ear. Don't put anything in the child's ear, that's very important. Don't use Q-tips and things like that. No Q-tips, no olive oil, no eardrops. Definitely take your child to the pediatrician, and parents will be taking their children to the pediatrician, and make sure that you get the vital signs again upon admission or upon arrival at the clinic. That's very important. Now we're going to talk about some of the most common pediatric emergencies and nursing care. Some of the most important things to do and some of the emergencies that we see at the hospital include when pediatric patients do start getting the flu and things like that. Dehydration is some of the most serious things that we see. The patients have already been nauseated, they've been throwing up at home for days, and then mom or dad are finally able to get them in to see their PCP, and or they bring them into the emergency room, and then we take care of them from there. And some of the orders that we get are provide fluids, we obtain labs, so we're definitely going to have to start an IV on these little children and start giving them fluids. We're going to get blood, we're going to get their labs, and we really want to look to the cause of what's causing this dehydration. Some of the other things that we see are seizures, and when a patient's seizing, what do you think is the most important? What do you think is the most important thing when a patient is seizing? Yes.
Make sure they can breathe.
Yes, you want to make sure they can breathe, so don't put anything in their mouth. You can turn them over on their side, let them have their seizure. Do not put anything in their mouth, and then definitely they want to seek medical treatment. And a lot of times we'll give these patients specific medications to treat seizures, depending on how long their seizure lasts. The next thing we're going to talk about is burns, and burns are very common, especially in the winter, as people are making a lot of soups, and parents, family members, friends tend to leave hot coffee on a low setting, a little table or something, and children, toddlers especially, are prone to pulling down those coffee cups and those bowls of soup. And what we see commonly is that we get a lot of chest burns, some facial because of splashes. We'll see those types of burns. We definitely, when those patients come in, they're definitely emergently getting hot, getting hydration. They're going to end up with dressings and dressing changes, and the most severe ones, severe burns would go to an ICU to a PICU. There's also going to be patients that are experiencing respiratory distress, and for those you're going to immediately seek medical assistance. So burns and young children. So we're going to talk more about some more mild burns. Young children are burned by many common household items. We talked about that. We talked about the coffees and the soups and ramen noodle soup, so be very careful. Children, usually 8 to 10, 8 to 12, will put that ramen noodle soup in the microwave on their own. They'll come home from school and maybe mom's not there, and they will put that ramen noodle soup in the microwave for about 3 minutes, which is way too long. And when they pick up that ramen noodle soup, cup of soup out of the microwave, that will burst and they'll spill it because it's so extremely hot. And so we will see burns from that as well. As the nurse, remember that you're required to report any burns to a child 5 years and younger to CPS. That is a Texas law. Most burn accidents do happen at home. Almost 75% of all burns are scalding, which includes the coffee spills that we talked about, hot beverages, as well as hot bath water. So you want to tell parents constantly about checking the temperature of the bath water, because that can get very hot very fast, and parents sometimes don't even realize how hot that water is, and we do see children that have those types of burns. So different types of burns and their cause. You have wet heat, fire, steam, hot liquids, chemicals, and electrical burns, and all of these are medical emergencies. So remember, with mild burns, you can keep clean and apply aquifer, cold running water. Burns with blisters, it's very important when you have burns with blisters. What do you think you're supposed to do? What should you be doing when you see a patient with a burn with a blister? Yes.
Should you pop it?
No. Evidence-based practice says do not pop or break these blisters. You want to cover them, clean those areas, cover the burns, apply an antibacterial cream or Silvadene, apply a non-stick dressing, and always seek medical attention for children with burns. I want to talk about Watson's carrying theory. So Gene Watson's theory is a human science and human care theory that involves many concepts that are difficult for children to understand at the level in which they present. Caring is an important concept in nursing and has become the essence and central focus of nursing. So Gene Watson is who we're focusing on as far as her nursing theory is what we base this little teaching about. This teaching about pediatrics was based on Gene Watson's theory as far as her caring theory. And that's always going to be very important when you're dealing with pediatrics, because they need that tender nurturing. As you're seeing them, they're going to be upset, emotional. There's going to be lots of crying, because there's always crying with little patients that come in and they're hurt, and you want to nurture that and just definitely express your caring, swaddle them, hugging them if you can. All of those types of things will help to calm children. Now, here we go. Our references for this teaching today were for Pediatric Emergencies in Office Practice, an overview by Jonta in 2012, our medical journal, Armed Forces, India, and John Hopkins Medicine, 2018, Facts About Burn Injuries, retrieved from John Hopkins Medicine. I'm going to go ahead and pass out an evaluation for you guys to fill out. Just fill it out and then drop it off at the front of the class, and we'll take it from there. I hope that you have learned from this pediatric teaching. What we're going to do now, we're going to go over some NCLEX questions. We're going to review some NCLEX questions, and then we'll be talking about communication.